everyone, and welcome to another edition of the Malika Ramsey Show. I am Malika Ramsey-McPherson. Thank you very much for joining us for another great week. I want to take this opportunity to thank those of you who tuned in last week and for all your support and your kind words and all those things. We need that to keep our program going. Also, thank you very much for our sponsors who came on board. For those of you who are looking out for us live tonight, I can say this now because I know if you're watching this, then the program is already on YouTube and Facebook. So for those of you who were looking out for the program live on Channel 9 on Friday, unfortunately they had some technical difficulties, so we had to bring you a pre-recorded version. But of course, nothing is going to stop us from getting where we have to be and getting the message out there. Well, as I advertised on social media earlier in the week, I should say earlier in the day, that we will be focusing on fibroids and women this week. The reason I chose to focus on that because I think it's still a conversation that women are either ashamed to have or just apprehensive about having it, or even afraid to have this conversation. And I am so happy because we reached out to a local gynecologist Dr. Nirvani Singh. She's not just a gynecologist, but she'll give you a brief background of her work in the medical profession, in the medical field, so you'll understand that she knows exactly what she's talking about. So I am happy that she accepted our invitation to come on the Malika Ramsey Show, especially the second edition. So it's really fabulous to have her. And on that note, I welcome Dr. Nirvani Singh to our program this evening. Dr. Singh, good evening and welcome to the Malika Ramsey Show.
Thank you so much, Malika, and thank you once again for your invitation. I'm happy to be able to share my 2 cents about uterine fibroids, which is one of the very common benign tumors that is, troubling our women in Guyana and around the world.
And I know once you use the word tumors, people get nervous. I get nervous.
They do, but there's no reason to get nervous because, well, I'll explain a little bit in detail later on about fibroids and what exactly they are.
All right.
So, just a little bit about myself. I'm Dr. Nirvani Singh. I studied medicine in Cuba, and then I returned to Guyana, where I completed my residency in obstetrics and gynecology. For those who are wondering what's obstetrics and gynecology, that's the part of medicine that doctors, take care of women and issues that women would have, mostly pregnant women and women with fibroids, uterine cancer, cervical cancers, etc.
So this conversation is directly in your field.
It is.
All right, let's get right down to it. What are fibroids?
So fibroids are basically benign tumors that arise from the uterus. Let me just break that down a bit for the viewers, right? So the uterus is basically the womb, what we call the womb. Tumors are just masses that grow on the womb, and those are fibroids. As I said, benign before, that benign basically means that it's non-cancerous, a non-cancerous tumor that grows on the uterus.
Okay.
It affects our reproductive aged female mostly. Yeah.
I'm happy you said aged female because you hear different things, and again, these things make people afraid, unfortunately. Is there a demographic, age, ethnicity, or is it and well, unfortunately, I have to call it this. Is it an illness or a condition that does not discriminate?
I'm glad you mentioned that. So when we speak about fibroids, research has not shown a specific etiology that causes fibroids. However, there are certain risk factors that can predispose women to developing fibroids. About 80% of women from African descent tend to develop fibroids, compared to about 70% of women who are Caucasian develop uterine fibroids. So yes, women of African descent are more predisposed to having fibroid compared to other women. Other factors that can predispose women to fibroids may include obesity, so being very careful with your diet. Eating healthy is very important. Early age of menarche, that means women who see their periods at an early age, they tend to develop uterine fibroids because their bodies are exposed to these hormones at an early age. Yeah. Certain foods, little studies show that eating red meat can predispose women to uterine fibroids. Also, genetics play a great role in the development of fibroids. That's why when you come into our office, we usually ask you about your family history. Does your mom, does your aunt, does someone have fibroids in your family?
Oh, so it is indeed genetic, because again,
It can be.
you read and you hear so many things, and sometimes you try to do research for yourself, and I can remember someone saying to me that it's not heredity, it's not genetic, we don't know where it comes from or how or why it comes.
I'm glad you mentioned that also, because we have another set of patients that come into us and they have no known risk factors, but they still have fibroids.
Oh.
So it can be genetics, and it could just be something that we don't know as yet that's causing, uterine fibroids.
I'm sorry to get to this almost immediately, but I'm not sure if I missed it in anything that you said, but the biggest concern usually, is it at any point cancerous?
Uterine fibroids are benign tumors, right? There's a 1% chance, very, very rare chance, that uterine fibroids can develop into something called leiomyosarcoma.
Okay.
And that's cancerous. However, we do very careful follow-up of our patients. For patients who are asymptomatic, we tend to order ultrasounds for them every 6 months or every year to follow up, see if they become symptomatic. And there are treatments for fibroids.
Okay, all right.
So they're benign tumors.
Okay, great. Viewers, if you're now tuning in, my conversation this evening is with Dr. Nirvanie Singh. She introduced herself. Of course, if you missed it, you're watching this on YouTube. For those of you who are looking for us live, we apologize for not going live on Friday evening. And it is because we were unable to go live, we weren't able to show some of our advertisements. So I just want to take a breather and remind you that our program comes to you with the kind compliments of Spring Fresh Purified Drinking Water. Their areas of delivery are East Runbelt, Lamaha Springs, Lamaha Gardens, and they deliver daily from 6 a.m. to 6 p.m. You can look out for their van, or you can call 669-1001. It also comes to you with the kind compliments of Big Mac's Meals on Wheels. Of course, they have a variety of dishes to offer, and as some of you would have seen last week, but we promise to get those advertisements back to you next week. You can call them for delivery on 694-0728 or 615-6557. And also, it comes to you with the compliments of Designs Royal. They specialize in designing and printing business cards, ID badges, flyers, posters, tickets, brochures, banners, certificates, invitations, and calendars. You can call 669-1001 to capitalize, to take advantage of their service. Remember also to advertise on the Malika Ramsey Show. You can send us an email, of course, or shoot us a WhatsApp, or you can also message us on Facebook. The email address is themalikaramsey.show@gmail.com. And now we continue with our conversation with Dr. Nirvanie Singh. Dr. Singh, as I advertised that we would be speaking about fibroids, one person inboxed me. Of course, she got a bit confused because she immediately thinking, it's a privilege to be called a doctor, especially in these times. So apparently she thought I was a doctor. So her first question to me was, is this why she's not getting pregnant? So of course I had to explain to her. I will ask the doctor this evening. Let's talk about that aspect of it. Does it create fertility issues in layman terms? Does it prevent a woman from getting pregnant?
So my answer to that is yes, it can cause fertility. That is possible. However, if a woman presents to us with a fertility issue, we usually do all the workup to exclude other causes of infertility before we assume that it's fibroids that is causing the fertility issue. Because every day we have women coming in with fibroids that are pregnant and they have their babies, they deliver safely, and we follow them closely. Okay.
And do you find, because I've also heard stories of women having fibroids and fibroids miraculously disappear after delivering a baby?
Yes. Sometimes that depends on ultrasonographic well, the ultrasonographers. Sometimes you have very small fibroids that you can pick up on ultrasound, and then you go back to different ultrasonographers, and then you don't see the fibroids there. Sometimes it's very difficult to pick up small fibroids. Yeah.
So the smaller they are, the better for the female.
Yes, you could say that.
All right. How can it affect quality of life, if at all?
A lot of females that come into us on a daily basis do express that, fibroids affect them greatly. They have expressed that they've been through depression, anxiety. Women generally state that they have a fear of expressing, admitting that they have fibroids to their family or to their spouses because they have this concept in their head that, once you have fibroid, your family members, especially like mother-in-law, sister-in-laws, might think that, fibroids cause infertility, and they have a fear of expressing that to their spouses and family members. They also have a fear that fibroids might be cancerous, and when they come in, we reassure them that
it's not.
Yes, they're just non-cancerous tumors that grow on the uterus.
Do you believe, because, I think I started off the program by saying that I believe it's one of the things, and I really can't understand why. We're in October, this is Breast Cancer Awareness Month. We talk about most diseases. You did just point out that why some patients and so on may be afraid. But what would you say to get women now to become, if there is a need to become more open about fibroids and effects and causes for them and how they suffer? It just in a sense of sharing information with a younger woman or other, it doesn't have to be a younger woman, but other females who may be experiencing the same things but have no idea, aside from talking or visiting a doctor, have no idea what to do with themselves.
So fibroids is one of the most common tumors, as I mentioned, and when I say tumors, I don't mean cancer. It's a benign mass that grows. I assure you that we can follow up, we can treat fibroids. There's both medical, expectant, and surgical management that we can do for fibroids. Young women may experience heavy menstrual bleeding, meaning your period can last more than 7 days, or heavy bleeding. People can experience lower abdominal pain, back pain. The fibroids can grow on the uterus and cause compression to adjacent organs, meaning the uterus is in the middle, there's a bowel behind, and there's a bladder in front. So if you have a fibroid that's compressing the bowel at the back, you can have constipation. If you have a fibroid in front that's compressing in front of the bladder, you can have urinary frequency. Yeah, so the symptoms generally vary, and I want to advise you to not get scared if you experience any of this. If you do an ultrasound and you see fibroids on the ultrasound and you're symptomatic, you just go to your health center, you show that to your doctor, and they can advise you on how to proceed with further management.
Not to be monotonous, but I don't know if you can give specifics. At what point does or do they become surgical?
That's a very good question. So we have fibroids that are asymptomatic and fibroids that are symptomatic. Fibroids that are asymptomatic are usually very small and they don't trouble the patient. So when they come to us, we just advise them, exercise, diet. We do follow-up ultrasound, that is, every 6 months to a year.
Every 6 months, okay.
To a year, we do, ultrasounds to check on them. And fibroids that are symptomatic, meaning large fibroids that are causing discomfort to our patients, we provide medical management is the first line, and then followed by surgical management. So when I say medical management, I mean giving you medication to help with your symptoms. So mind you, these medications do not shrink the fibroid or do not take the fibroid away, but they help with your symptoms. So you can go about your daily basic activities. There's also surgical management, and when we speak about surgical management, patients that failed the medical management or
it's still bothering them despite
who's having daily discomfort because of the symptoms, we advise them that they can proceed with surgical management. So our surgical management that we offer in Guyana, two basic surgeries, they're called myomectomy and hysterectomy. So the myomectomy is basically doing a surgery to take out the fibroids from the uterus. However, the uterus itself, the womb, is conserved so that woman can still become pregnant. Those are for women, who still want to have babies and stuff like that. And for older age women who do not desire fertility, With large fibroids, we proceed with hysterectomy. So that is taking the uterus completely out. So the fibroid cannot recur. However, with the myomectomy, I should mention, there is a possibility that you can have fibroids in the future again. So if you had a myomectomy and you took out one fibroid, there is about a 27% chance that you can have fibroids again. And if you take out more than one fibroid, there's about a little more than 50% chance that you can have a recurrence of fibroids again.
In a case like that, what do you do? How do you advise the patient? Do you try to go back in and remove again, or you?
Well, this takes years. So it's taking out the fibroid today,
and going
and
back
the fibroid
next month.
comes back next month or 2 months after. So we counsel our patients on, that they can have recurrence of fibroid, and how we can monitor them and how we can treat these recurrence. It's based on a patient and doctor decision.
All right. Again, if you're now tuning in, we are talking with Dr. Nirvanie Singh, of course, from the local health sector and the local national health sector, and she is enlightening us on fibroids in women. And as I said, we chose this topic this evening because I believe that women are still somewhat in the dark. I read one article some time ago talking about some women. They have so much trouble sometimes even getting out of bed. They're called lazy and so on, and this could be one of the causes. Dr. Singh also talked about depression, some people going through depression. So I think it's, in a sense, it's not talked about enough. And some people suffer and don't even know why they're suffering, don't even know what the problem is. So I am hoping that after my conversation with Dr. Singh this evening, it will shed some light and encourage you to go get yourself checked and to ensure that is not what is bothering you. And if that is the case, that you will find ways to manage it based on some of what Dr. Singh is saying. We touched a bit about shrinkage when I asked you if after pregnancy or after surgery, if it can grow back. Let me ask you if this is a myth. I heard someone say a long time ago that she knows of people who she may see them, because one of the physical things is that your stomach gets, some women you see it, the stomach is bulky or big, or in our language here, big. She was explaining that one time she knew of a woman who had fibroids, and she saw her and her tummy was really high, and then 3 months after she saw her again and there was nothing there. It just went by itself. Is that a myth?
Okay, so I'm not sure if the fibroids can disappear in 3 months. However, to answer your questions, fibroids can shrink. So there are two main hormones that cause the growth of fibroid, I should say, which are estrogen and progesterone. So while you're in your reproductive age, while you're having your menstruation, that is, your body produces those hormones. When you enter something called menopause at age around 50 or so, you stop seeing your menstruation, so your body generally stops producing that level of hormone that causes the growth of the fibroid. So since the fibroid doesn't have that anymore, what happens, it starts to calcify, or meaning it starts to shrink. So it is possible that fibroids can shrink.
They can shrink, they can disappear without anything happening.
Without treatment.
And you talked about the size earlier. So again, it's also possible for a woman to have fibroids and not know that,
that she has fibroids.
Based on your experience in terms of talking to patients and so on, do you believe that there is a lack of, not just a lack of knowledge, but there is a fear? I mean, you talked about people not wanting their families to know. Maybe they will think that they can't have children and so on. But apart from that, generally, do you think that women need to be more open about it? Am I correct by saying that the conversation is lacking? Is there a gap there?
Most definitely. I think women out there need to be more aware of fibroids, their symptoms. They need to know that it's not something cancerous, it's something totally treatable. We can give you medication, we can offer surgical management, you can get pregnant. There's nothing to be ashamed of. There is help that is offered by your general physician and your gynecologist also, if needed.
Okay, all right. Again, you're the doctor here, you're the medical person. Is there anything at this point that you think I may have missed, that you would, not just that I may have missed, what else do you feel the need to let women know about fibroids. Uterine fibroids is the correct term at this point, and things that they possibly should look for and so forth.
Okay. So I mentioned a little bit about symptoms and signs before. Sometimes women might have fibroids and they're totally asymptomatic. They would not know unless you go to your ultrasonographer and they do an ultrasound and it picks up fibroids. People tend to get scared when that happens, but as long as you don't have symptoms, we don't usually offer any treatment for it. If you get pain, there's pain management we can offer. Heavy menstrual bleeding is the most common sign that I mentioned before. Compression symptoms such as it may cause constipation, urinary frequency, back pain, lower abdominal pain, generally discomfort. So there's nothing specific,
that you can say look for and say, okay, well, I think I may have this. You have to go ahead.
And then again, you have women that do experience these symptoms, but they can have a different pathology, not just uterine fibroid. So if you're experiencing any of these, I would advise that you visit your local doctor, your health centers, and they can do further workup and they can advise you on how to proceed, whether you need to visit your gynecologist or whether they can offer treatment for you.
I want to ask this question. We've heard about, and you probably can touch a little bit, even though you're not here to talk about that specifically, you can probably touch a little bit on endometriosis. Are the two related? Could they possibly be related at all? Endometriosis and uterine fibroids.
So endometriosis is kind of different from uterine fibroid. So what we call endometriosis, just to break it down for the viewers, is the inside of the uterus or the lining of the uterus usually has a tissue called endometrium. Sometimes that tissue can implant in different parts of the body outside of the uterus where it's not supposed to be, as in on the ovary, on the uterus, behind the uterus, on the bowel, omentum, liver, and organs like that. So whenever you have your period, what happens is that you have bleeding, right? So that bleeding releases like inflammatory cells which can cause pain. That's why patients with endometriosis usually have a lot of pain during their menstruation.
Okay.
And fibroids can cause pain.
But the two are not necessarily related. To say that someone has, again, I did talk about the physical appearance. When women have fibroids, the stomach area is bulky. Is that the same thing as saying a woman may have a bulky uterus? Is that the same thing?
Yes, kind of. When we do our physical examination, when a patient comes in, we do a vaginal examination to examine the size of the uterus, the position of the uterus, if it's mobile or not. And when we say the uterus is bulky, it means that, uterus is larger in size than normal. There is probably something that's causing it. Could be fibroids, could be something else. We have to do other workup to determine whether it is or isn't.
It is. So at the end of the day, you must visit your doctor.
You must.
All
if
right.
you're experiencing symptoms.
All right, great. So I hope the person who sent the message asking about whether or not it is causing her fertility issues, I hope you got your answer, and I hope that you take the necessary action. Dr. Singh, I want to give you a minute or so to just again talk about the function of your clinic, who can come, especially in light that in light of the fact that we are living in the COVID era and precautions and so on that you may be taking. But for women out there who again may be suffering, can they access certain information and guidance and so on from the clinic in which you function?
Yes, most definitely. All women with different pathologies are welcome to our clinics. We work from our clinic is open, that is, from Mondays to Thursday, and then on Friday we have a different clinic. But from Monday to Thursday you can access the gynecology clinic. In order to do so, however, you must visit your local health center or your general doctor so that they can do a proper workup, and if they see it fit, they can write a referral letter to us for us to assist in for management of your case.
Okay. Okay, it's not a case where they can just walk into your clinic just like that off the bat.
No, we see more than 100 patients per day, and with COVID and everything like that, we're glad for the extra help from the doctors in the health center. And they're qualified doctors too. They know how to manage fibroids, and if it's a situation that they can't handle, they would refer the patients for further management.
how has your clinic been able to survive? And at this point, I must pause to say, I mean, you sometimes you watch these medical shows on television, and of course they loop everybody into first responders. But I must take this time to say congratulations to of course this program is going to be loaded to YouTube. So I know people around the world who choose to, especially gynaes who choose to log in, will see it. So I take this opportunity to take my hats off to all medical professionals around the world, across the globe, to you yourself, and to ask, how have you managed, the entire medical environment in which you work? How have you been able to manage and survive during the COVID era, which is really horrifying to so many of us?
Thank you for your kind words again, Malika. It was very, very scary at the beginning. We took all precautions, but as doctors, we took an oath to always help our patients. So patients were diagnosed with COVID, and the numbers just grew daily. Even pregnant patients are diagnosed.
Yeah, how do you deal with the pregnant women and transmission and all of that? We're thinking about mother to child, and how do you deal with that?
So we have protocols that we work with in the hospital. When their patients are admitted, they're usually screened for COVID, and COVID tests are done. And if they're tested positive, then they're isolated in a separate part of the hospital from the rest of the patients. If the mom delivers, then the baby is separated from the mom at that instant until she completes her days of isolation, or if she needs treatment. Yeah. So it has been indeed very hard for us, but we're really, really trying, with our patients and to help them get better.
All right. Thank you very much, Dr. Singh. I don't know if you missed anything. Did you?
I don't know. If I did, you could remind me.
Yeah. Well, from my end, I don't think you did. Again, I want to thank you for taking time off. And folks, again, wherever you're watching us, you should know that she took time off of her job to come here and sit with us. So they're not only working in the interest of our health and safety, but she's also working in the interest of getting the information out there to you. And as I said, I felt that fibroid was an important conversation. We're going to do some more research, and at some point, maybe if not have Dr. Singh back, someone else who can also shed some light on it as the program goes on, and as we continue to do more research and so on, and see if there are any aspects of it that we would have missed. But I want to thank Dr. Singh, Dr. Nirvani Singh, local gynecologist, for taking time out of her busy schedule to come and share with us and encourage us, to take a look at our bodies closely, especially women, when it comes to fibroids. As you know, we ended up talking a bit about COVID, but our main conversation tonight would have been about for fibroids, so uterine fibroids. So Dr. Singh, thank you very much for coming and sharing with us.
Thank you once again. I'm glad to have shared my 2 cents on uterine fibroid. I hope that someone out there would have learned something from what I said. And once again, I want to remind you, don't be scared. Fibroid is very common, and there's treatment for uterine fibroid. Just visit your local doctor, and we can proceed from there.
All right, great. As I did say, for those of you who attempted to get us live, we were unable to go live, so we weren't able to show our advertisements. But even before we wrap up, I'm going to have tonight's final word. As you know, that's our final segment. Our program only began last week, so we're still trying to get our ducks in a row. But for tonight's final word, I want to focus on the fact that today, Friday, October 15, 2021, was dedicated as Global Hand Washing Day. Let me just read for you quickly, because I think this is also very, very important, especially, again, since we're living in an era where washing our hands has become essential. It should not have taken a pandemic for us to understand and learn and know the importance of washing our hands, but that is what it is. It is what it is. We don't make the rules, we just live by them. But to read from some research I did, Global Hand Washing Day is an international hand washing promotion campaign to motivate and mobilize people around the world to improve their hand washing habits. Washing hands at critical points during the day and washing with soap are both important. And I want some of you to take note of that, because sometimes you finish a task and you think just throwing the water, splashing the water on your hand is washing your hand. No, that is not washing your hand. You have to wash your hand with soap. So I'm happy that they pointed this out. Global Hand Washing Day occurs on the 15th of October each year. I think this year the celebrations are under the theme Our Hands, Our Future. So that is tonight's final word. And we focused, last week we focused on mental health. This week we focused on hand washing for the final word. I take this opportunity to thank you very much for inviting us into your homes. Thank you for supporting the Malika Ramsey Show. We look forward to your continued support and all the positive energy and the positive vibes that you can bring our way. And we'll be happy, and our program will certainly be a success. Again, thank you very much to Dr. Nirvani Singh for coming, and I trust that you learned as much as I did on uterine fibroids. Until next time, I am Malika Ramsey-McPherson. Thank you very much for watching.